everyone. We have a wonderful patient of mine. She is 30 days out. Her surgery was on the 1st, and just want to get some feedback. How do you feel now given your BII symptoms?
I really honestly feel amazing, and my symptoms are just about 80% gone. And you know, when I went through my list, and it feels like as time goes by, it's an aha, oh, that's gone. I don't have that anymore. And I was a little skeptical at first, thinking, how are these things going to go, like hocus pocus? And I'm here to say that it is absolutely real. The heel is real. I wasn't going crazy. I had Hashimoto's before I had the implants, but I truly believe 100% that my body created an immune response to the implant, and over time my symptoms just got worse and worse and worse. And I will tell you that in July I could not open a jar of salsa. My hands hurt so bad, and my feet hurt so bad that there were days that I would be limping up the stairs. I was so mad that we bought this new house with stairs, because I was worried that if I kept going the way that I wasn't going to be able to do it. And I'm young and it's embarrassing. It's so embarrassing to say that out loud. And I can't wait until I am released, because I want to run up the stairs. I don't have these pains anymore. I don't have these feelings that I had. Thank you, Dr.
Thank you. Thank you very much for sharing. You know, this is very important, so that way we can tell the world, you know, this is not a placebo effect 1 month out, you know, and that you will continue to enjoy life, and you will continue to basically be minus all these small things like opening a jar and walking up a flight of stairs. You know, now one other thing I always ask, how was your anesthesia experience?
So apparently I wake up super fast, and when I got home, my husband is like, you need to relax, because I felt great. I wasn't groggy. I did have a little throat feeling like sore, because I'm sure there was something in there, but it wasn't intolerable. You know, put it this way, if I had to do this 100 more times to feel like I do right now, rather than the way I did in July before this was done, or August, you know, I would do this 100 more times. Mm-hmm. So that's what I can say. You know, I was really nervous because, you know, age-wise, I was about 10 years older than when I had them put in, and so much has gone downhill in terms of the way I'm feeling, and, you know, just my overall health. That I was very nervous about surgery, but as soon as I woke up, I realized it was over. It felt like it was over just minutes after it started, and I haven't felt this good in a very long time.
Great. And you know, I have to mention, you had a ruptured right breast implant,
yes,
silicone, correct?
Yep.
And the left one was 550 cc's, relatively very large, 550 cc's. And you know, did you how do you feel now where you look aesthetically, as far as a lift and no lift, and what was going through your mind?
So I wish I would have taken pictures of myself right before. I know that you have some, but I didn't. But I have it in memory and things like that. I look better now, which is really it's kind of awesome. I do, you know, I'm 10 years older, and you have to understand that, you know, my breasts don't look like I'm 21 years old, but they look amazing, and I don't want to lift. I'm so glad that I didn't go elsewhere and have a lift and everything, because they're great.
No, thank you very much. And I say that day the whole focus 100% was to get all the toxins out, the implant capsule plus any inflamed tissue, especially on the right. And you had no drains. you know, and despite this was done in the en bloc fashion, everything contained, and you followed my instructions, you were compliant with the bra and the binder, and God bless you. And you know, this is what the heal is real. No one should suffer. You know, this is very important, and I'll end with this. The surgeon in his mind or her mind needs to be absolutely 100% committed that the patient's post-operative bounce back and good health and the freedom from the toxicities is truly dependent on the surgeon taking their time, meticulous dissection such that the entirety of the implant capsule plus any inflamed tissues removed, and they are determined to do that from their heart, and that not for that reason they're not augmenting, because this is what it takes, that commitment in the surgeon's mind to doing the job complete, because that is what translates to a happy patient free of all these toxins. So this is critical and important. Thank you again. God bless you for sharing your story. And we will continue to hear from you at 3 months, 6 months, so that, you know, many people say, well, the last, you know, I have a lot of critics that say, oh, this patient was on the Norco, she was post-op day 4 or 6.
Oh, no.
Yeah.
I haven't taken any pain medicine since day 2 post-op.
Yeah.
I didn't need to. I just took a leave, and I'm still taking like a leave at night if I need to, just because, you know, this is kind of still healing.
Yes, yes.
But I haven't taken any of those pills. That
Right, and 30 days out. And the point I'm trying to make here is this will stand the test of time, and this is not a placebo. This is real. You're a real life patient with a real life, with real job, real kids, husband. And the point I'm trying to make is you're not hurting no more. You're back to enjoying life, which everyone deserves.
Absolutely. Thank you.
You're welcome. Thank you.